class. Welcome to Chapter 20, Vehicle Extraction and Special Rescue. After students complete this chapter and the related coursework, they will be able to describe and apply in context in 7 steps of the vehicle extraction. Additionally, they will understand the characteristics of emergencies related to water immersion, diving problems, confined spaces, farm accidents, and bus accidents. Introduction. The extraction process consists of 7 steps. Special rescue situations can be life-threatening to both the rescuer and the patient. Types of special rescue situations include water rescue, diving problems, ice rescue, confined space rescue, farm emergencies, and bus collisions. In each situation, your first objective is to maintain your personal safety. Extraction. You will need several hours of practical exercises to become skilled in the process of extraction. You should be familiar with extraction equipment, its use, and the hazards involved in the extraction process. Ideally, rescuers should wear protective equipment similar to a firefighter's outfit, including coat, pants, boots, helmet with face shield, gloves. Minimally, a helmet with a face shield or goggles and gloves should be worn. To ensure the best care for the patient, many different agencies may need to cooperate. Keep in mind these basic guidelines. Know the limitations of your training, equipment, and skill. Identify any hazards, gasoline, power lines, or wires, hazardous materials. Control these hazards for which you are trained and equipped. Gain access to the patients. Provide patient care and stabilization. Move patients only if absolutely necessary. As an EMR, you have 2 primary extraction goals: to obtain safe access to the patient and to ensure the patient's stabilization. Step 1. Conduct a scene size-up. As soon as the dispatcher tells you of the incident, begin to anticipate and plan for what you are likely to find on arrival. Use your knowledge, but be flexible in planning. If the dispatch information is complete, you will know which types of vehicles are involved, whether there are injured or trapped people, burning vehicles, or hazardous materials present. As you approach the scene and before you exit your vehicle, get an overview of the entire incident. Rapidly determine the extent of the accident or incident. Try to estimate the number of patients. Try to locate any hazards that may be present. Call for whatever assistance you may need to maintain the incident. The figure below shows as you approach the incident, look over the entire scene. Step 2. Stabilization of the scene and any hazards. Keep a sharp lookout for hazards that can result in injury, disability, or death. Infectious diseases. Many patients involved in motor vehicle crashes have soft tissue injuries and actively bleeding from open wounds. Follow standard precautions at all motor vehicle crash scenes. If sharp glass or metal is present, wear heavy-duty leather gloves over latex or vinyl gloves. If there is any danger of splattering blood, consider using face protection. Traffic hazards. Park your vehicle and other emergency vehicles so that they protect the scene and warn oncoming traffic to avoid the crash site. Consider the design of your vehicle's warning lights and park so you can use them to their best advantage. Wear an approved safety vest and other personal protective equipment. Ignite fuses or warning flares as soon as possible. Survey the scene for other hazards. Bystanders. Keep bystanders away from the crash scene by giving them specific directions. Use a rope or police fire barrier type to establish an off-limits area. Spilled fuel. Expect to find a fuel spill if a motor vehicle has been hit near the rear, is on its side, or is upside down. If a fuel spill is present, call the fire department. If patients are in a motor vehicle with a fuel spill and the fire department has not arrived, consider covering the fuel with dirt. Motor vehicle batteries. Reduce the possibility of an electrical short circuit by turning off the vehicle's ignition. Do not attempt to disconnect the battery unless you have been trained in the proper way to do so and have the necessary tools. Hybrid vehicles and electric vehicles have large quantities of batteries. Downed electrical wires. Downed electrical wires may be caused by high winds, ice buildup, or a vehicle hitting a utility pole. Locate the wires, but avoid contact with them. If the vehicle has a downed wire across it and passengers are trapped inside, immediately instruct the passengers to stay inside the car. Keep all bystanders away from the vehicle. Call the utility company for assistance. Call the fire department for assistance. Be sure to check everywhere, including under vehicles, for electrical hazards. Unstable vehicles. Assume that every vehicle involved in a crash is unstable unless you have manually stabilized it. Vehicle on its wheels. Ensure stability by chalking the front or back of each wheel with hubcaps or pieces of wood. If you can gain access to the inside of the vehicle, place the transmission in park and set the parking brake to prevent the vehicle from moving. You can deflate the tires by safely cutting or pulling the valve stins. The figure on the left shows chalking the wheels, and the figure on the right shows how to deflate the tires to help stabilize the vehicle. Vehicle on its side or upside down. Stabilizing a vehicle on its side is beyond the range of skills and equipment for many EMRs. If you must enter the vehicle to respond to a life-threatening situation, do not climb on the vehicle. Carefully break the rear window glass to enter through the back of the vehicle. Bend over or crouch down to stay close to the ground. An upside-down vehicle is relatively stable. The primary hazard is spilled gasoline. Vehicle fires. Impact fires occur when the gas tank ruptures during the crash. The vehicle is rapidly engulfed in flames, and it soon becomes impossible to approach it for a rescue attempt. Passengers are usually rescued by bystanders and witnesses to the crash. Post-impact fires are often caused by electrical short circuits and can be prevented by turning off the ignition. Should a fire occur, first turn off the ignition, extinguish the fire with a portable fire extinguisher, and remove the passengers from the vehicle as soon as possible. Emergency actions for motor vehicle fires. Use a dry chemical fire extinguisher. Immediately have someone else gather fire extinguishers from other vehicles at the scene. Use the extinguisher to keep the flames out of the passenger compartment. Do not be overly worried about discharging the fire extinguisher onto the passengers. The dry chemical powder is non-toxic. Remove patients as quickly as possible, but take care because they may have sustained injuries. Move anyone at least 50 feet away from a vehicle that is on fire. Stay away from the front and rear ends of a burning vehicle. Step 3. Gain access to the patients. Access through doors. Between 85 to 90% of all patients found in motor vehicles can be reached simply by stabilizing the vehicle and then opening a door or rolling down a window. Try all the doors first, even if they appear to be badly damaged. Make sure that the locking mechanism is released. Try the outside and inside handles at the same time. Access through windows. Do not try to break or enter through the windshield because it is made of plastic laminated glass. The side and rear windows are made of tempered glass and will break easily into small pieces when hit with a sharp-pointed object. Carry a spring-loaded center punch as part of your EMR life support kit. If you must break a window to open a door or gain access, try to break the one that is farthest from the patient. Advise ambulance personnel if the patient is covered with broken glass. After breaking the window, use your gloved hands to pull the remaining glass out of the window frame. Try to unlock the door again. To access a vehicle through a window, follow the steps in Skill Drill 20-1. When you gain access to a crashed vehicle, be alert for undeployed airbags. If you cannot gain access to the vehicle, to do what you can to assist the patients. Stabilize the vehicle and protect the scene until the proper equipment arrives. Step 4. Initial emergency care. Conduct a patient assessment on every patient. Monitor the ABCs, control bleeding, treat the patient for shock, stabilize the cervical spine, provide emotional support, maintain the patient's body temperature with a blanket. Leave patients in the vehicle unless it is on fire or they are otherwise in immediate danger. Skill Drill 20-2 shows how to perform initial airway management when the patient is in the vehicle. Step 5. Patient disentanglement. This process usually requires tools and specialized equipment. In some serious extraction situations, disentanglement can take up to 30 minutes and requires advanced training. Modern rescue crews use the concept of the golden hour when managing serious trauma situations. The less time spent at the scene with seriously injured patient, the better. The patient's chance for survival increases if rescuers can get the patient to definitive medical care as soon as possible. Step 6. Preparation for patient removal. As disentanglement proceeds, dressings, bandages, and splints are applied and the patient's head and spine are stabilized. The access route used to care for the patient may not be adequate as the extraction route. The extraction route must be large enough to permit the safe removal of the packaged patient. Step 7. Patient removal. Once the patient is packaged, he or she is removed from the vehicle and placed onto a stretcher of the transporting ambulance. Although you are directly involved in only the first 4 of the 7 extraction steps, you should be aware of the entire operation. Review of the extraction process. Call for additional resources and extraction help. Specify the number and types of vehicles involved. Do not stand idly by while waiting for help. Identify and contain hazards. Park your vehicle so that its headlights and warning lights can be used to protect and light the scene. Clear a working area around the site of the crash before you or rescue personnel attempt to stabilize the vehicle or vehicles. Use your head. Think and use what tools you already have. Try opening the doors first rather than breaking windows. Once you gain access to the patients, assess and monitor their conditions. Above all, remain calm. Water and ice rescues. Water rescue. The person in the water may be fatigued, may have sustained a diving injury, or may have fallen through the ice in the winter. Jumping into the water to save someone can endanger your own life. In a water rescue situation, remember these steps. Reach. Use any available object. If the person is close to shore, a branch, pole, oar, or paddle may be long enough. Throw. At a swimming pool, dock, or supervised beach, a flotation device may be available. If a life buoy is available, throw it to the person in distress. Some public safety departments carry a specially constructed rescue throw bag that contains a rope. If these aren't available, improvise. Throw a rope, plastic milk jug, sealed cooler, or spare tire. Row. Row out to the drowning person if a small boat or canoe is available. Consider this option only if you know how to operate or propel the craft properly. Protect yourself by wearing an approved personal flotation device. Go. As a last resort, you may have to go into the water to save the person. Enter the water only if you are a capable swimmer trained in life-saving techniques. Remove encumbering clothing before entering the water. Take a flotation device with you if one is available. The figure below shows the rules of water rescue. Initial treatment of a person in the water. In a water rescue situation, your primary concerns are threefold: open the airway, establish breathing and circulation, stabilize spinal cord injuries. Skill Drill 20-3 describes how to turn patients who are face down in the water face up. Use the jaw thrust maneuver to open the patient's airway. Do not hyperextend the neck. Look, listen, and feel for signs of breathing. If the patient is not breathing, start rescue breathing while the patient is still in the water. If the patient has experienced cardiac arrest, quickly stabilize the head and neck, remove the patient from the water, place the patient on a hard surface, and begin CPR. Treat any patient who is unconscious in the water as if he or she has a spinal cord injury. Also assume the presence of a spinal cord injury if a conscious patient in the water reports numbness or tingling in the arms and legs, is unable to move the extremities, or reports neck pain. Strap the patient to a backboard, stabilize the head and neck, and remove the patient from the water. Diving injuries. Most recreational divers use self-contained underwater breathing apparatuses, SCUBA. SCUBA gear consists of an air tank, a regulator, a mouthpiece, and a face mask. Most underwater diving accidents occur in coastal regions or in areas with large lakes. Diving accidents can cause trauma, near drowning, or specialized injuries. In situations involving trauma or drowning, remove the patient from the water and treat the patient using information and skills you have already learned. Specialized injuries associated with diving include air embolism and decompression sickness, or the bends. Both are caused by air bubbles being released in the body as a result of pressure changes while diving. If an air bubble affects the brain or spinal cord, the signs and symptoms may be similar to those of a stroke: dizziness, difficulty speaking, difficulty seeing, and decreased level of consciousness. If an air bubble causes a collapsed lung, the signs and symptoms will include chest pain, shortness of breath, pink or bloody froth coming from the mouth or nose. If the air bubble obstructs blood flow to the abdomen, the patient will experience severe abdominal pain and may be bent over. If the air bubble involves a joint, there will be severe pain in that joint. Treatment. Maintain the patient's airway, breathing, circulation, and normal body temperature. Administer oxygen as soon as it is available. Some physicians recommend placing the patient on his or her left side with the head of the patient slightly lower. Patients with diving injuries may be needed to be transported to a hospital that is equipped with a hyperbaric chamber. Ice rescue. Ice rescue is extremely hazardous because no ice is truly safe. Do not exceed the limits of your training and do not put yourself at undue risk. Visually mark the location where the person was last seen so other rescuers can concentrate their efforts on a limited area. The basic rules of ice rescue are the same as those for water rescue: reach, throw, row, and go. Reach for the victim using anything that will extend your natural stretch. Throw a flotation device, throw rope, or anything that floats to pull in the victim. Row or propel a small boat to the victim, or use a toboggan to get across the ice. If you must go, secure yourself to the shore with a rope around your waist, lie on your stomach, and proceed across the ice. Spreading your weight over a wider area reduces your chance of falling through the ice. Maintain good communication with other rescuers. A motor vehicle on the ice presents a risky situation. Instruct the vehicle's occupants to avoid unnecessary movement. If the vehicle has not gone through the ice, instruct the occupants to open the vehicle's doors. If the doors cannot be opened, instruct the occupants to roll down the windows so they have a better escape route. During ice rescues, both the persons on the ice or in the water and the rescuers are at risk for hypothermia. Keep all rescuers as warm as possible. Rescued persons should be stripped of wet clothing, dried, and warmed as soon as possible after they are removed from the water. If a patient has no pulse, start CPR and continue until the patient has been transported to the hospital and warmed. Confined space rescue. Confined spaces are structures designed to keep something in or out. Confined spaces may be below ground, ground level, or elevated structures. Below ground confined spaces include manholes, below ground utility vaults or storage tanks, old mines, cisterns, and wells. Ground level confined spaces include industrial tanks, farm storage silos. Elevated confined spaces include water towers and storage tanks. Rescue situations involving confined spaces have two deadly hazards. Respiratory hazards. The confined space may have insufficient oxygen to support life, or a poisonous gas may be present. Rescuers must never enter a confined space without proper respiratory protection. Collapse hazards. In a mine, rescuers may need to shore up the confined space before they can safely enter. In a confined space situation, call for additional assistance and do not enter the space until help arrives. The figure below shows confined spaces that may have insufficient oxygen to support life without the use of self-contained breathing apparatus. Farm rescue. Farm accidents pose a wide variety of challenges for rescuers. Reporting of an emergency may be delayed if the farmer works alone. There may be a lengthy response in getting to a farm. It may be hard to pinpoint the exact location of the emergency. Poor roads, non-existent roads, and muddy soil may require you to leave your vehicle some distance from the patient. Farms contain a wide variety of hazards. Animals can seriously injure farmers and pose a serious risk to rescuers. Farms contain a wide range of hazardous chemicals, pesticides, herbicides, and fertilizers. Farms use many types of electrically powered machinery. Be alert for the shock hazard posed by the presence of electrical lines and electrical devices on any part of the farm. Some accidents involved tall barns and silos. These accidents often require rescuers trained in high-angle rescue techniques. Silos should always be treated as hazardous confined spaces. Some farms include below-grade manure storage pits, which are filled with poisonous gases or are deficient in oxygen. Accidents with farm machinery usually involve rollovers of farm tractors, entrapment in machinery, and severing of body tissues by sharp objects. Your role in farm rescue. Stabilize the scene and provide initial medical care for the patient. Follow the 7 steps of extraction. Perform a careful scene size-up to determine the scope of the problem. Shut off any electrical power and turn off any machinery that is still running, if possible. Call for adequate assistance from fire, rescue, and EMS organizations. Stabilize any hazards that you can while keeping yourself and the patient safe. If possible, gain access to the patient. Provide initial emergency care to the patient. Establish responsiveness, support the patient's ABCs, control bleeding, maintain the patient's body temperature, provide emotional support. As other rescuers arrive on the scene, help them to disentangle the patient, prepare the patient for removal, and remove the patient. Bus rescue. Because of the large number of people being transported by buses, bus crashes may occur in any community. Crashes involving buses are considered multi-casualty events. Your role in bus rescues. Perform a scene size-up. Call for adequate police, fire, or EMS response. Establish an incident command system if multiple casualties are present. Set up a one-way traffic pattern for responding vehicles to avoid congestion and gridlock at the emergency scene. With a large number of patients, triage the patients using the START triage system. Summary. You must be able to perform the first 4 steps in the extraction process and assist other rescuers with the steps 5 through 7. Ice rescue, water rescue, underwater diving accidents, confined space rescue, farm rescue, and bush crashes are situations that require extensive skills and special training. It is important to help the patients, but not at the expense of your own safety. In water and ice rescue situations, you can take some simple steps to help the person without endangering yourself, including reaching out to the person with an object, throwing a flotation device to the person, or rowing to the person in a boat. You may not be able to distinguish between the 2 major medical emergencies created by underwater diving incidents, air embolism and decompression sickness, but you can provide basic care and summon appropriate assistance. In confined space rescue, your primary goals are to call for additional assistance and to prevent other people, including yourself, from becoming victims. Farm emergencies and bush crashes are complex rescue situations. However, if you follow simple steps, you can often stabilize the situations and provide initial aid to patients. Okay, class, let's go over some review questions. Review question 1. Which of the following would not be considered a special rescue situation? A school bus collision. B, a hiker who has fallen through the thin ice. C, a diver who is discovered unconscious on the surface. D, an elderly man with chest pain at the park. The correct answer is D, an elderly man with chest pain at the park. Review question 2. As an EMR, your primary goal in extraction is to A, use specialized equipment to access patients. B, assess patients safely and stabilize them. C, reach patients as quickly as possible to administer pain medications. D, dismantle the vehicle or machinery. The correct answer is B, access patients safely and stabilize them. Review question 3. Once you have access to the patient, you should A, perform an assessment. B, rapidly extricate the patient. C, administer oxygen. D, immediately begin treating injuries you see. The correct answer is A, perform an assessment. Okay, class. This concludes the lecture on Chapter 20, Vehicle Extraction and Special Rescues. If you have any questions or concerns, please contact your instructor, and I will see you in the next chapter.